The spread of COVID-19 to the developing world is going to push many countries into a crisis. Once the disease is rife in those countries, it could easily rebound to the West. In India, the announcement of a lockdown sparked a mass exodus of migrant workers who rushed back home to their villages. But beyond these powerful images of packed transport hubs lies the devastating reality of a pandemic in the developing world. Applying a nationwide quarantine and social distancing guidelines here in India will prove far more difficult than in developed countries. That's because around 40% of the entire urban population lives in slums like these. Here, the population density is far greater than even the busiest capitals of Western countries. Entire families inhabit overcrowded dwellings, and streets aren't wide enough for everyone to stay 2 meters away from each other, making it the ideal breeding ground for the virus. What's worse, most don't have access to a source of clean running water in their homes, meaning that they have to travel every day to reach a communal tap or use a public toilet.
Running piped water supply is a dream for a lot of them. It's not that they can turn on a tap and access water. So which means that just fetching water for you on a daily basis is a bit of a struggle. You'll have to go to a community stand post, wait for your turn, wait when water arrives in that stand post, collect it. But the moment you start using community water stand posts, you then also start to need to worry about hygiene while ensuring that you're taking water from a tap. So someone who's potentially infected could be turning on the tap, collecting water and going away. The next person who comes might not know. You then need to extend this to another level, which is that a lot of them might also be using public toilets or community toilets, which is that they won't have their own private individual household toilet. So then how do you extend precautions into that space as well? So when you're struggling to ensure that you have 3 meals a day, soap becomes a luxury.
Aside from being physically impossible to self-isolate, it is also economically impossible to do so. Most of those who inhabit these slums are informal workers who live hand to mouth and can't afford to stock up on food. Many will have to make the difficult choice between working but risking contamination or staying at home and facing extreme hunger. These shocking images shared on social media sparked outrage. Starving migrant labourers from New Delhi returning to their ancestral homes in Uttar Pradesh in the hope of shelter were doused in disinfectant at the state border, showing the lengths that some were going simply to survive.
The Indian economy consists of, it's a 90% informal economy. So most of these workers are either contract workers, casual workers. They're also daily wage workers, piece-rated workers, and especially in the supply chains, they work in a lot of micro and small enterprises. And many of them are also own account workers, like drivers, street vendors, rickshaw pullers, cooks, plumbers, electricians, and several home-based workers. It's a pandemic and not just a medical crisis, but also a social and economic crisis as well. Several operations, businesses have been stopped, working hours have been curtailed, and many staff have lost, many workers have lost their daily wages and livelihood options. They need basic necessity and support right now. They need shelter, they need drinking water, they need ration, they need all the essentials, soaps and detergents, which is really needed at this stage.
The Indian government announced a $22 billion aid package, but this will only help a minority of poor Indians, and disruption to the fragile food supply chain here is already causing shortages. A weak healthcare system is the other main concern. Developing countries have some of the lowest numbers of ICU beds per capita in the world, while the United States provides 33 ICU beds per 100,000 people. India only has 2.3. And the scale of the spread is hard to predict. The current number of those infected or killed by coronavirus in India is still low relative to some European countries. But the shortage of tests means the real number is likely to be much, much higher, and it is still climbing. With roughly 80% of the world's population living in developing countries, where disease can thrive, COVID-19 is not just a threat, it's an inevitability. And as long as the virus is spreading, it could rebound to the rest of the world.